Athletic Training Month was put together by the NATA, which is our national organization, the National Athletic Trainers Association. They wanted to come up with a program that would highlight what we do in the fields where we work at, whether it be high school settings, collegiate settings, clinical settings, fine arts areas, things like that. So that way it was more or less a campaign to promote us to the public, to show us what we really do as healthcare professionals. I guess back when I was in high school, I was a three-sport athlete, played football, basketball, baseball. Remember my freshman year, I got hurt. I was in the training room a lot from football season. Wound up being in there with the athletic trainer was doing with me. I got to see all the cool stuff that they did with using the stem machine and the ultrasound, doing a lot of the manual therapies and things like that. So that kind of sparked my interest because I always wanted to go into the medical field. And one of the things that was really neat about this was I got to be around sports all day long. So it was awesome. So I was kind of killing two birds with one stone. So that's kind of what got me into athletic training.
Growing up, I always was interested in science and biology, and that led me to wanting to be a medical professional. For the longest time, I did not know what I wanted to do with that. I at first thought I wanted to be a physical therapist and then medical school, but through a lot of hard decision making and shadowing different doctors and physical therapists, I decided that I wanted to pursue my bachelor's degree in athletic training.
So this year, with COVID being the forefront across the world, one of the biggest things that athletic trainers got to showcase was our versatility, whether it be, we're always here taking care of the kids with the athletes of, injury prevention, injury evaluations, things of that nature, but we're able to take on other roles where it was going into the hospitals, doing health screenings, taking on other roles even with the district with doing health screenings at some of the schools. But one of the biggest things that we were able to kind of showcase as well, that one of the things that we do as an athletic trainer is also deal with the mental health aspect. So there's many times where, I know myself and my staff have spoken with many of our athletes on a mental health level, just trying to help them through the trials and tribulations of, not having a season. Are we going to have a season? The differences that came along with playing sports during COVID, where it was, isolation. The only time you get to see people would be at practices or games. So that was one of the big challenges that's occurred this year as an athletic trainer.
This past year, I think, has shown a lot of the strengths that athletic trainers have, our versatility in the field of medicine, whether that's sports medicine or infection control. Specifically, I've done a little bit of everything. I've done my normal job. I've been a temperature screener at a industrial location. I've been on lots of talks or phone calls with different other specialists talking about the policies that need to be made. So to summarize, I think that this past year has shown just how versatile athletic trainers can be.
With TriHealth and CPS, we're finishing up our 5th year right now with our contract. This was a 10-year venture between the two parties, and I think since we've been here, we've been able to provide a lot of good, not only for the community at Walnut Hills and the staff here and the student athletes, but also for the district in general. We've been able to help them develop policies for COVID in conjunction with some of our physicians at the hospital. One of our infection control doctors has spoken with the athletic department many times on assisting in creating COVID policies. We're always available to help when CPS has any needs, whether it be youth camps or other types of things like that. We're available to help cover events for them. And then also we've been able to provide some extra coverage at some of the schools that may not have an athletic trainer. We've been able to kind of help them out a little bit as well in their time of need.
So what I love about athletic training is I get to be there for the second the injury happens to the second that kid comes back from the injury back to the court or the field. This year I've had a lot of examples of that happening, and it's a constant reminder of just how rewarding this job can be.